Participants from across 3 ministries are being trained to improve care and development of young children. For the next 2 weeks, 2 groups of frontline personnel who interact directly with parents are learning how to better equip young children for learning before they start school.
The evidence is there now that we need to start early. 90% of the brain is developed before 3 years of age, and that's the time that is ideal for us to help the family, to help the child to prepare for a better learning experience in later life. One of the greatest pillars is the care for child development, which is a set of technique and tools that we'll be using, training parents on how to play and communicate better with children and to respond to their needs.
Activities for children vary according to age, with emphasis on play and communication. Oftentimes, this process starts before the baby is born, where parents are encouraged to start communicating with the child.
We already know by our evidence that if you talk to a child very early, they will develop words, speaking more words by the time they're age 3, for example, than a child who doesn't have that kind of experience. So that's an activity. Now, how do you talk to a child, a baby? Do you talk to the child in full words? Do you make the same noises as the baby? We encourage them to sometimes make the same noise as the baby's making, respond to the baby. So we have an activity called Copy Your Child. So we do things like play peekaboo when the child gets older. And there are a number of things that the child is learning by playing peekaboo in terms of response, give and take, back and forth. In a conversation, peekaboo is a conversation. And the other thing that it really does is it helps the parent learn to pay close attention to the child.
The Care for Child Development strategy is applicable in any setting, particularly outside the classroom.
It's applicable anywhere. It's applicable at a health center while the nurse or the doctor is providing care. It's applicable through the Roving Caregivers Program at community level. And it's applicable by the parents themselves once they receive the training and the counseling from the different providers from the 3-line ministries.
Those activities help children learn faster and control better their emotions, things that will prepare them for school. The benefits of care for child development are many and go all the way into adulthood.
We now have studies that show that children who get these activities before age 2 earn more, are more productive as adults, 25% more in terms of adult earnings if you've had these stimulating activities. And this is especially important for children who are at risk, the children who were born small, too small, or the children, they can catch up. They really can catch up. Children who are disabled, have disabilities, so that children who have these opportunities, our studies show, in fact, are less enticed into criminal activities. They are more productive in school, so they can take advantage of the opportunities in school better than if they don't have these activities. We are also learning in a whole new field to study these children as they grow older to see their health benefits. We find, for example, that there's less heart disease when the child is older. It's amazing. How do these things happen below age 2 that will affect the adult's heart disease? But the connections are now being made.
Reporting for News 5, I'm Andrea Polanco.